Over the last 3 decades, he's served as the voice, the face, and the momentum behind medical change and growth across our region. He also represented rural health on the national stage in Washington, D.C., instrumental in crafting policy. In tonight's Q2 Rewind, a look back at Dr. Nicholas Wolter. From the time Dr. Nicholas Wolter first set up shop with a medical practice in 1982 to the time he retired as CEO of Billings Clinic in 2017, Wolter watched this modest medical community grow into the expansive medical corridor we know today, his hand guiding much of that development.
Healthcare has been one of the bright spots in the Montana economy.
Playing a key role in the 1993 merger between the Billings Clinic and Deaconess Hospital, he took the helm as CEO in 1997 and held the reins for the next 20 years.
System approaches to quality and patient safety that allow us to accomplish care for patients that is better than any of us could do alone.
In that time, Wolter was often the voice of the hospital, whether in times of visionary growth,
bringing hospital, community, and physicians together,
times of pain.
The hospital expects to save $6 million through the layoffs alone.
We'll be identifying the number of positions in their areas that should be arrived at.
And times of celebration.
L-I-T-Y!
We know that we can get more patients, a much higher percentage, the appropriate therapy, and that's really what we're working on.
His reputation as a leader in the healthcare community also made him a trusted voice for lawmakers.
The regulation, the ambiguity, the amount of paperwork has become so overwhelming that it truly is draining away the time and attention that providers have for patients.
Wolter also appeared a number of times on our Q2 newscasts over the years, advocating a personal cause that was close to his heart: organ donation.
There are 80,000 or so individuals in the United States waiting for an organ.
His own stepdaughter, after her tragic death, gave her heart, liver, and kidneys so others could be whole again.
Thanks to Jill, Here I am. I made it.
All this happening in a time when rising healthcare costs and thinning insurance coverage placed a strain on hospitals everywhere.
Gosh, I look at the next few years and you just wonder how we're going to figure this out with healthcare costing so much and the premiums going up and so many people uninsured already, and then all these Medicare issues. There are some big problems that don't seem to have any apparent solutions.
Challenges Wolter faced with sobriety and vision.
To become proud of the things that have been accomplished, but at the same time humble about areas where you know improvement can occur, and also humble about the fact that the challenges we face over the next 10 years to keep moving forward are significant, and you sort of have to keep your eye on the ball to address those challenges.
Dr. Nick Wolter died September 7th. He was 70 years old. And besides changing the face of healthcare across our region, on the personal side, Nick Wolter loved jazz music and enjoyed floating and fishing on the Yellowstone River south of Livingston. Jay.
Thank you, Janelle.